my back would hurt. And it was depressing. It was not the way I wanted to live my life.
I felt depressed, and it was constant all the time. It was something that wouldn't go away.
Depression can cause pain, and pain can cause depression. Now, sometimes pain and depression create a vicious cycle in which the symptoms of pain worsen the depression, and then the depression worsens the feelings of pain.
You can't really do anything. You stay in the bed a lot of the time. You cannot live constantly being in pain.
For so many people suffering with back and neck pain, not only can depression set in, but also the feeling of hopelessness.
You're used to being able to do something and you can't do it. Things are being taken away from you. I kind of started losing hope in myself that I would be able to have that quality of life that I wanted.
If someone's been told that there's nothing that can be done for their pain and they have to live with their back problem, they can be pretty down, pretty depressed, a feeling of hopelessness. And at Southeastern Spine Institute, we think that that's usually not the case.
80% of Americans will suffer back pain in their lifetime, which can then lead to depression and then more pain. That's why it's so important to go to a spine specialist as soon as you can, because you do have options.
They're feeling good, they're smiling, and I think they realize they're kind of on the road to recovery and this is a whole new life for them.
I'm just happy, but I do believe it. I don't think I'll be there again, and I'm cured.
Hi, I'm Vanessa Hill.
And I'm Angie Mazzell.
Welcome to all of you watching. Stay tuned for this edition of the Southeastern Spine Institute's medical show on spine health.
See for yourself how the latest medical treatments are helping more and more people break that pain-depression cycle and get back to their happy, active lives.
The girls at work were laughing because I FaceTimed them, and I told them how great I felt.
All under one roof and always one step ahead. The Southeastern Spine Institute proudly present The Age of Spinal Medicine. During this medical documentary, we'll explore the latest in modern technologies and techniques, speak with spine physicians, and hear stories from actual patients. Once again, your hosts, Vanessa Hill and Angie Mazzell.
So many people suffer from back and neck pain. If you're one of them, remember, you're not alone, and there's help for you.
And like Melissa Collins, you're not sure how you hurt yourself or when the pain started. You do know that it keeps getting worse, and it changes your life.
It slowly, gradually got worse and worse and worse, and I tried all different things, you know, exercises and everything, and nothing worked, and it just got so bad that I would go into Home Depot, and as soon as I walked in there, I'd have to find somewhere to sit down. In grocery stores, I'd have to lean over on the grocery cart and push the cart to try to bend my back a little bit and get the pressure off.
Melissa owned and loved riding horses. She and her husband even bought a horse trailer to go camping. But as Melissa's back pain started keeping her from her passion, she refused to give up.
We bought this horse trailer as our retirement plan, and we would go camping and horseback riding. And that kind of came to a screeching halt. Couldn't sleep at night. I would just go to bed crying because my back would hurt so bad.
Melissa lives near Columbia, South Carolina, and she experienced what many in her area may have found. It is difficult to find the help you need for your problem in a timely manner, and even when she did get in to see her local doctor, she wasn't getting any better.
And they said it would be, 6 weeks before I could see him again. And this was after 9 months of hurting really bad and going to see the doctor. It would still hurt, and so I'd have to call again, make an appointment, and that would be 3 weeks out from then. And so the pain never went away. It was just still constant pain.
So finally, Melissa knew she had to take things into her own hands.
I'd heard about Southeastern Spine Institute and great things they'd done, and finally I just got fed up and I said, I'm going to call them. So I called them and they said, it was a Tuesday, and she said, we can see you Thursday. And I said, I will be there. Dr. Anderson took an x-ray, and I'm not even a medical professional, but it was clear to me my back was beyond repair with injection. So he said we would need to do surgery, and he explained it.
Melissa had a very serious back problem. She had a condition known as spondylolisthesis, which is actually where two bones in the spine become too loose and begin to separate. The L4
in the L5 bones, and that's where your spine was slipped really far forward. Fortunately, her condition is one that does respond well to surgery, and we were able to do a minimally invasive procedure to correct the problem.
Utilizing the latest medical technologies found anywhere in the country, a team at the Southeastern Spine Institute performs minimally invasive surgeries where the surgeon comes in from the side of the patient. Avoiding cutting any muscle, skilled surgeons make an incision less than an inch long. A small tube is inserted and tiny instruments are used to correct any problems in the spine. Oftentimes, these modern surgeries allow people to get back to doing some of the same things they were doing before they experienced the back pain. And in Melissa's case, it meant pursuing her passion of riding horses.
Riding horses are my passion. They're a great pastime for me. They're a great therapy for me. Be able to get on a 1,200-pound animal and just kind of wander through the woods, look at nature and the beauty that God's got out there for us. And we love to go camping and take the horses with us and get back to nature. Now I can.
Melissa had such a love of horses and horseback riding that it was extremely satisfying to be able to give her that back.
Can I please thank absolutely, you? Yeah. I cannot tell you thank you so much.
Yeah, absolutely.
He doesn't realize what an impact he gives on people's lives by healing them. He's got a gift, and it's awesome to feel this good.
Who would have thought that after having back surgery, someone would go back to riding horses? It really was a gift.
Yes, a lot of that has to do with the doctors at the Southeastern Spine Institute because they utilize the latest medical technologies and techniques, some that weren't even available 10 years ago.
And when we come back, we'll talk with a retired police officer who was so looking forward to his planned retirement, but then back pain not only put those plans in jeopardy, it also led to depression and loss of hope.
I was depressed. I kind of started losing hope in myself that I would be able to have that quality of life that I wanted.
Everyone knows the Southeastern Spine Institute creates medical documentaries on spine health. They're all about the latest medical procedures that help people get out of pain and back to their active lives. Now you can stream any of our shows to learn more. Just go to southeasternspine.com/streaming. Watch stories from real patients about how new medical advancements are helping people live without pain. And to make your own appointment, call 866-SPINE50 now. No referral is needed. Welcome back to the Age of Spinal Medicine. Our next story is about Mario, a Washington, D.C. police officer who retired and moved with his wife to a beautiful home in Charleston. He was hoping to enjoy a well-deserved retirement, but slowly his back pain got worse and worse. And then his life really changed.
2015 is when I retired. And then when I came down here, the back just kept getting progressively worse. My quality of life was, I was suffering big time.
Suffering big time for Mario meant he was feeling such a loss of life. Even simple things were painful. And as we now know, persistent pain over time can lead to bouts of depression.
I was really depressed because you're used to being able to do something and you can't do it. Things are being taken away from you. Doing simple tasks like getting up and down a chair, things that people take for granted, I wasn't able to do. And used to being physically fit, lift weights, shooting guns, and living life, and I couldn't live life.
It's bad enough to live with back and neck pain for a long time, but it can get worse. And that can lead to a cycle of pain to depression, where the depression leads to more pain, and more pain leads to more depression. However, the physicians at Southeastern Spine understand the importance of breaking a patient's pain cycle as quickly as possible, because so often people have already been suffering a very long time before they come in.
On the very first visit, I met with Dr. Anderson. He took an x-ray of my back and he said, well, here's your problem right here. It was all elementary. I mean, it was right there. And from that very first visit, I had a ray of hope that, hey, this was going to get better.
Helping people get better is why the Southeastern Spine Institute has everything under one roof. Here you'll find the latest medical procedures for back or neck pain, plus the experience of many physicians in all areas of spine medicine who, working together, can provide the latest spine treatments for your specific issue.
One of the things that's great about our practice is that we have multiple different specialties under one roof, including physical therapy, rehab, pain management, and surgeons.
Sometimes patients give up on any treatment option, believing that, okay, my back gotten older and there is nothing we can do. Big, but definitely enough to cause or potentially cause some of your symptoms. But there are several treatments available, so it's always worth getting expert opinion on that subject.
We're here to treat you using the least invasive techniques, hopefully to give you the best result without having to undergo any further intervention.
Over 90% of the people who come to Southeastern Spine find long-lasting pain relief without ever needing surgery. However, if because of a structural issue in the spine, surgery is required. Here you will also find the latest technologies and surgery procedures found anywhere in the country. So when it turned out an operation was the best course of action for Mario's condition, he was in the right place to have the latest modern surgery.
Mario was able to have his surgery done through a minimally invasive approach, and this small incision surgery allows for faster healing, a lower risk of infection, and an overall better outcome.
And after Mario's successful operation, his pain cycle was broken. He was no longer in pain or depressed. And he shared with us that he was so happy to have found the Southeastern Spine Institute right in his new hometown.
Well, number one, they took care of me, and number two, they're in my own backyard. They're here in South Carolina, and proof is in the pudding. I feel good.
The minimally invasive approach we used with Mario allowed him to get back to doing the things that he loves to do during his retirement.
I'm doing what I want to do again. I'm lifting weights, I'm riding my bike, I enjoy shooting.
I come here at least once a week, I shoot, and it's great to be able to come here. I feel like my old self. I love it.
You know, Andrew, with more and more people moving to the Lowcountry and calling it home, it is nice to know that if they have problems with their back or their neck, the latest spine treatments are right in their own backyard.
And as you know, the Southeastern Spine Institute often takes part in national medical studies and in many cases helps develop the new technologies now seen in the field of spinal medicine.
And when we come back, we'll take you to the Southeastern Spine offices in Mount Pleasant and talk directly to spine physicians, and we'll ask them about some of these new technologies.
One of the new technologies that we've been involved with lately is robotic spine surgery that assists us in surgery with placing instrumentation.
Always one step ahead. It's not just a slogan, it's what they do here at Southeastern Spine. New robot technology is now coupled with a unique implant system developed by surgeons at the Southeastern Spine Institute. This combination allows for more precise, minimally invasive surgeries, better outcomes, and can help you get back to your active life sooner. At the Southeastern Spine Institute, you know you'll be getting the latest in spine technology because they help develop it. Call 866-SPINE50 to make your own appointment.
Welcome back. We took our cameras to the Southeastern Spine Institute to find out more about these new technologies. One of the recent additions to the staff, Dr. Tim Bryan, explained some of the latest technologies that are now being utilized at the Southeastern Spine Institute and why bringing in newer doctors is positive for the practice.
Hey, sir, Tim Bryan. New ideas, some new procedures that can be performed, brings in a new energy with a young surgeon in the practice, brings a little bit of a different approach to some things.
So people have same problems that they had 10, 20, 30 years ago, but the way that we're approaching those problems is to do it in a way that is less and less invasive. And we've done a lot with that over the last 10 years, and as technology continues to develop with us, one of the new pieces that's been developed is robotic-assisted surgery.
The doctors here explained that by using this new robotic-assisted surgery, less x-rays were needed and the patient is exposed to less radiation. Plus, the robot assist also works well with the modern implant system that was in part developed at the Southeastern Spine Institute, making for a less invasive approach. Using these new surgical technologies, Southeastern Spine patients often have shorter recovery times and may get back to their active lives sooner. And if you are experiencing back pain and you happen to work at Southeastern Spine, you might have discovered what front desk supervisor Celia Simmons found, but she was already in the right place. Celia works at the front desk at Southeastern Spine, and she sees people come in with pain every day. But often, after getting treatment, they find that their pain is gone. So when she started having trouble with her own back and experienced leg pain, she knew she could get help right here from the doctors she worked with every day.
Because I see how the patients come in pain and they go back and they're not in pain anymore. All right, thank you, and I have you all checked in.
Okay, thank you.
It helped me tremendously. You won't believe. But I see all these other people come in and they get help, their pain is gone. So I wanted mine to be gone as well.
Over time, Celia tried many different non-operative treatments to get out of pain, but her issue needed to be addressed with a minimally invasive surgery. But the good news was that Celia was soon out of pain and back to work in no time, now able to help other people with similar problems and see that they also were able to get back to their lives. One of her favorite stories is about a patient who couldn't stand up straight.
I had one patient, she came in, she was bent over, she couldn't look up at us. So she saw Dr. Poletti, she had MRI done. They said she needed surgery, she had surgery, and when she came back, she was standing up straight and she looked us in our eye and said, "Y'all, I can see y'all now." And I just thought that was great.
Often we can do the surgeries through very small incisions using an endoscopic tube. We can make the operation less invasive than it was even just a few years ago.
They come back and they be like, "Oh my God, this is great." And you just see the smile on their face. And that just made me feel good because we helped them.
You know, Vanessa, anytime we're at Southeastern Spine, it seems like the doctors are really glad to be working there.
Yes, and when you are helping someone in pain, it is so rewarding to see the before and the after. Plus, with all of this new stuff coming out in terms of medical treatments, it is an exciting time to be a practicing physician.
And speaking of treatments, we know that when you're in pain, time matters. And when we come back, we'll see that it is especially true if you're experiencing numbness or even a loss of mobility in your arm or leg, because at that point, it's best to see a physician as soon as possible.
I did not go to see the orthopedic up in Myrtle. It would have been a month. And I knew a month with a numb arm and not being able to use it probably was too long.
Relief from back pain is just a day away. The Southeastern Spine Institute now helps end your back or neck pain with same-day surgical and non-surgical procedures. We're helping more and more people get out of pain faster, utilizing the latest microsurgical procedures, including cervical artificial disc replacement. Same-day surgery gets you back to your active life sooner. Call 866-SPINE50 or go online at southeasternspine.com to schedule your own appointment. No referral is needed. Welcome back. Many times pain travels down the arm and leg, but what about numbness or loss of use? In our next story, we'll meet Greg Glaude, who, while he was not in a lot of pain, he didn't have full use of his left arm.
I could move my hand, but I couldn't move my arm. I couldn't lift it up. So everything I was used to doing with my left hand, couldn't do. Simple things that we take for granted, brushing your teeth. I couldn't raise my hand up to my teeth to brush. Try doing something with the opposite hand and see how easy and how good you are at it. Not very good.
Greg was very worried about not being able to use his left arm, and he wanted to see a doctor as soon as possible. But getting in to see the right doctor can be difficult, and sometimes that wait time can make the problem even worse, as Greg found when he called a local doctor.
It was going to take a month to get an appointment, and I thought that was too long. So I called Southeastern Spine. Was able to get an appointment that same week.
Gregory came in to see me after he was trying to get an appointment at an outside facility and had trouble getting in. And one thing we do pride ourselves is being able to get people in as quickly as possible.
And I knew the nerve was pinched because my arm had gone completely numb and it wouldn't come back.
It kind of went dead on me about 3 weeks ago.
Surgery was really the only option.
What I'd recommend doing is we go in there and fixing that with taking the pressure off the nerves so we can reduce that pain and get some of that motion back. That is one thing that pushes us towards having surgery sooner, and such as Gregory's case, because he was so weak.
If you're experiencing weakness, numbness, or prolonged tingling in the arms and legs, you want to get that checked out as soon as possible. It's important not to let things get worse because that can lead to permanent nerve damage. Here at the Southeastern Spine Institute, we have a team approach when it comes to our patients. We want to make sure you are seen by the appropriate specialist for your specific back or neck problem.
Our unique setup at Southeastern Spine allows us to get you in with the provider that you need to see as soon as possible.
It's our job to try to determine what could be the source of the pain and then which approach would be most beneficial for the patient.
We need to have you come in right away to get these symptoms treated so that you're not waiting around for another doctor who may be booking far out in advance and may put you at risk of having worsening symptoms or having permanent damage.
At Southeastern Spine, they see lots of patients every day, yet less than 10% of them ever need surgery. As we've explained, surgery is always the last option because they have so many non-operative treatments to help you get better. However, in Greg's case, because of the grave concern of possible permanent nerve damage, both he and Dr. Bryan agreed that performing a minimally invasive procedure as soon as possible was the best course of action.
Surgery went great. I'm glad I went there, because if I would have waited a month to see this doctor up in Myrtle Beach, the likelihood of me being back to normal and using my arm again would probably be pretty low.
Great.
Much better, huh?
Great. Gregory, when he first came in, couldn't lift his arm, and now he's back to doing everyday life.
Mow the lawn, do all the yard work, trim all the shrubs, cut the fronds on the top of the palm trees, clean the pool, take the dogs for a walk.
All right, let's go to the beach. Let's go for a ride. Stormy, can you get up there? Here you go, buddy.
Greg loves playing with his dogs, and he's so glad he didn't wait to get checked out. He knew the longer he waited, the less likely he would get back the full use of his arm.
Angie, we've been talking about it. It can be serious to have numbing in your leg or arm. Did Greg say anything about why he waited?
Well, I did ask him about how long he waited to pick up the phone, and not surprising, he wished he had done it sooner.
It took me a couple weeks, 2 to 3 weeks, before I made the call. And it took till my arm got numb enough and the nerve got pinched enough that I couldn't use it to make the call.
You know, Greg's story is not unique. There are many people, maybe people even watching this show right now, who are experiencing some sort of numbness or loss of mobility in their arms and legs. And I can tell you, after doing this story, it's simple. Just come get it checked out.
Speaking of making the call, when we come back, you will hear from a patient who did make the call to 911.
The truck tail end went one way and the front part went the other way. It was out of control. I couldn't hold it. I ended up going down in the bridge, in the water, truck turned over on the side. I couldn't get out.
Here at Southeastern Spine, they understand your back and neck pain. That's why they opened their new medical center, so you don't have to live in pain and you can get the help you need now. We practice COVID safety precautions and there's no need to go to a hospital. Call, make your own appointment at 866-SPINE-50. No referral needed. After all, it's your back. It should be your choice. Welcome back. You know, most of you drive a vehicle that weighs around 3,000 pounds. But can you imagine driving a huge 80,000-pound semi-tractor trailer truck and it's totally losing control?
Driving my 18-wheeler, and I was coming from the paper mill in North Carolina. I saw a bunch of deers crossing in the road, and I slammed on brakes, and my truck jackknifed. It was out of control. Truck turned over on the side. I thought I was dead. I had an out-of-body experience. I was like, am I still alive? It was just unbelievable.
For Denise Washington, it was unbelievable. But she was also lucky that help was just a phone call away and that the EMTs were not too far off. But that didn't end her problems.
And after that, I started feeling a lot of pain in my neck. I couldn't move my neck.
What happens when someone goes through a horrible accident and suffers major trauma? Well, their lives may change forever.
They're in pain constantly. You want peace and quiet. You just be in your room. That's no way to live. I was told I needed to go see a specialist. It was my choice on where I wanted to go, so I chose to go to Southeastern Spine Institute because I heard that they were the best.
Miss Washington doesn't look like a truck driver, but that's how, in fact, she hurt herself.
When the pain shoots down like in the back of my neck and it balls up, then this whole side right here started getting numb.
And she had to undergo a cervical operation or a neck operation.
I knew I had to get it done, but Dr. Pallady, he assured me that everything was going to be okay. He said, don't worry about anything, you're in good hands. So I had my surgery, and I'm 100% feeling much better than I was when I went there.
There's nothing more fun to see a patient who's been able to recover from their pain. You can see in her eyes that she's pain-free, and that's a good thing.
The man and his wife, he was like, "Can we take a picture?" I said, "Yes, sir, yes, sir." I love taking pictures. I am grateful that I am alive, because if it wasn't for the Southeastern Spine Institute, I don't know where I would be.
Denise is back to her normal life, doing things that make her happy. And one of those things is making special hats for people who lost their hair due to cancer treatment. Now that she is no longer driving trucks for a living, she is finding a new career helping others.
I create Niecy's hair hats for kids and adults that lost their hair to cancer. And I want to make something beautiful so when they wear it on their head, it doesn't look like they don't have any hair.
You can tell that Denise loves life, and she loves getting back to doing the things that she likes to do. And she has great praise for everyone at Southeastern Spine.
Everyone made me feel comfortable, the staff, his assistants. I mean, everybody has been so nice to me. And when I come in the door, they be, "Oh, there go the hair hat lady."
It is so wonderful to see someone come through such a life-changing ordeal with so much grace and appreciation.
Well, she surely did appreciate the help she received from the Southeastern Spine Institute. For her, they really were lifesavers.
Well, that's all for now. We hope you enjoyed our show, filled with stories from real-life patients who finally know how it feels to be out of back and neck pain.
That's why the Southeastern Spine Institute believes it's your back, it should be your choice.
And we leave you today with more thoughts from real patients who are so glad they finally found the Southeastern Spine Institute.
Join us again for another edition, and maybe we will be able to tell your story.
Bye-bye.
Southeastern Spine did give me my passion back, not only my life, but, you know, what really feeds me from inside. So thank you.
That's what this is about. It's my thank you to Southeastern Spine for saving my life and giving my life back to me.
It's definitely worth the drive. I would do it all over again. So it's not that far. Not compared to waiting 3 weeks to try to see a doctor that's 15 minutes away. You can drive an hour and a half and see your doctor that day.
I want to share with other folks that this was a wise decision and a good place to go to get it taken care of.
You are a real patient, you're not an actor.
Oh no, I'm a real patient. I'm not an actor, trust me.
If you go to Southeastern Spine, you are going to be given the best and most up-to-date treatment and advice and recommendations that you can find.
I'm very, very thankful. I feel very, very blessed. So, only way I could be more blessed is if I didn't have this problem in the first place.
If it wasn't for the Southeastern Spine Institute, there wouldn't be no life.
If you'd like to see any of our other shows on demand, go to southeasternspine.com/streaming. Here you'll find a vast array of programs covering most areas of spinal medicine. And for more information, go to our website, southeasternspine.com, or call 866-SPINE-50 to make your own appointment. No referral necessary.